Let me just pull up my list of talking points here. For those of you who don't know, Dr. Domar, Dr. Alice Domar is the executive director of the Domar Center for Mind-Body Health and a pioneer in the application of mind-body medicine to women's health issues, including infertility care. So thank you again, Dr. Domar, for joining us. And this topic is incredibly close to my heart, and I think so many people RSVP'd, not just because of your amazing, accomplishments in the field, but also because this is something that I think everyone going through infertility struggles with, and it's triggers. It's those, sucker punches when you least expect it. You see a pregnancy announcement on social media, you get a baby shower invitation in the mail, or just a stranger in the grocery store asks you, how many kids do you have? Or when are you having kids? And so obviously wanted to just pick your brain about all of these different scenarios. And specifically, the first thing that came to my mind was social media, because we're in such an age of technology, and, it can be used for so much good. Like, our page is really focused on sharing stories and helping women and couples feel less alone on their journey, because so that they know other people are right there with them. But, on the other hand, you're scrolling, you see your college roommate's sister got pregnant, by accident for the 5th time. So what is your typical advice to patients that come see you about social media?
Well, I simply tell them to hate everyone who gets pregnant,
That was a great answer.
And I have to say, I've been doing this for so long that when I first got into fertility counseling, there was no social media. And
Right.
So, for people, it really was either getting a phone call or getting something in the mail. And, if a woman's going through infertility, and I think we also all, anyone who's going through infertility has what I call pregdar. And so people may sort of suspect a friend or relative is pregnant. And so if they see them calling, this is before social media, they can just not pick up the phone. And then, and sort of, walk around the phone for a little while and then finally listen to the message or ask their partner to listen to the message. And so it wasn't like this immediate shock. I mean, obviously people were making pregnancy announcements at social events, not so much the last 18 months, but social media is really tough because my patients, you don't want to get off Facebook or get off Instagram or Snapchat or whatever it is you're doing, because it's sort of fun. I mean, I've been scrolling through Facebook this morning, but, not many people talk about how hard it is when other people get pregnant. And, I wrote a book called Conquering Infertility, I don't know, 15 years ago, maybe. And I think it was one of the first times anyone had really focused on the pregnancies of other people. People don't really talk about it. I think unless you've either been through infertility or or love someone who's going through infertility, other people don't get it. And sometimes men don't get it because men are very logical. And they'll say, well, what does her getting pregnant have anything to do with you're getting pregnant? Like, her getting pregnant doesn't decrease the odds of you getting pregnant.
Right.
So in terms of social media, I'd say, some people just get off social media for a while. If they're in a really vulnerable place, like if they've just had a treatment cycle not work, or they've just had a pregnancy loss, either get off social media or maybe ask your partner to sort of screen stuff for you. If you have a friend who is pregnant and literally posts every 5 seconds, maybe block her for a while until you feel strong enough. I mean, I think infertility is a temporary crisis, and sort of 1 through 10 importance. Number 1 is like, you've got to be self-protective. Like, it's not going to hurt someone's feelings because they don't know you're blocking them. But don't do it because you feel you have to.
Right. I actually discovered recently the mute feature on Instagram.
Okay.
So they won't know that you blocked them, but Instagram will just not show you their content. So that's because I found, and I still find, because I think, I've been trying for baby number 3, and like certain people trigger me, but then others don't, which is strange. Like, I'm genuinely so happy for the women in this community who get pregnant and after a long, journey. But then like a random person who just easily got pregnant with her third child on Facebook will set me off, and then I just have to remind myself, like, I probably wouldn't even know she was pregnant if I didn't have social media, because we're not close enough where she would have given me a phone call. But
Right.
but those people, I'm like, do I really need to see their stuff every day? No, mute.
No. Yeah. And and I think there are some people, I've talked to patients in the past, and I say, who upsets you when they get pregnant and who doesn't upset you when they get pregnant? And some of my patients have said, it doesn't upset me if someone who deserves to get pregnant gets pregnant. Like
Mhm.
someone, and I said, what's the definition of deserves to get pregnant? And they said, well, someone's like suffered a lot in their life, just had, lost parents or whatever, just, really deserves happiness, then that's kind of okay. If someone, is going through infertility, what my patients say is they have to have had at least one cycle with injectable medications. Like getting pregnant, like with an IUI or with oral medication doesn't really count as suffering. And so they say that to really deserve being happy for them, they have to have one cycle of needles. So that's not for me, that's for my patients.
Yeah, that's really interesting. I always struggled with, like, if I didn't feel happy for someone, that I was not a good person or something. But, it's not, it's just, you're not really thinking totally rationally during that time.
Well, I think also this is for many women or many individuals going through infertility, this might be the first time in their life where they are really pierced by jealousy.
Mhm.
I've had patients say to me, all along, I didn't care if my friends got better grades than me. I didn't care if they had cuter boyfriends than me. I didn't care if they got into a better college than me. None of that fazed me. She says, and they all of them say this, but this, when someone easily gets pregnant, I want to lie in bed and cry for 3 days with the covers over my head. And as far as I'm concerned, as a psychologist, I actually think that's a pretty normal, and I would actually consider it a pretty healthy reaction, because you feel so out of control of every aspect of your life. Your relationship with your partner, your job, your relationship with your family, your relationship with your friends, everything. And for someone to have sex, and first of all, why do people have to tell other people how easily it was for them to get pregnant? Like, I don't feel any need to know how many times someone had sex before they got pregnant. That's just, it's something people brag about, which I think is completely inappropriate.
Yeah, that's really true. I hadn't thought about it like that, but it's definitely really true. Yeah, I mean, there's so many conflicting emotions. What would your advice be to someone who, because I do get messages a lot from people who want to support those going through infertility, and maybe like gently tell them they're pregnant.
Yep.
What's your advice to those people who are just looking to do the right thing by their friend struggling?
Well, first of all, I'd say you are an amazing friend to be, if you are pregnant and you're worried that your pregnancy is going to upset your friend going through infertility, it means you're a really great friend. So, there's some do's and don'ts. I wouldn't tell her in person, because I would probably, either try to leave a message on her phone or text her or send her an email. Maybe send her an email where, then she can see it in private. I think I wouldn't even do text. I'll take that back. I would say probably the best thing is email, and just put, in the subject line, news which might be hard for you. And then when she sees that, she'll know, okay, this person's probably pregnant, and I'm at work. I'm not going to actually read the email till I get home. I think for most people going through infertility, hearing it in private when you don't have to jump up and down and pretend you're excited for them is probably the most sensitive. But I would say to everyone who's listening, who's going through infertility, you need to think about what's the best way for you to hear that news. And then if you have friends who you suspect might be trying, just tell them. Just say, hey, I'm really struggling, and this is really hard for me. It's really hard for me, that people get pregnant, even though I love you to death. So, if and when you get pregnant, can you just send me an email? It doesn't mean I'm less excited for you. It's just the best way to help you cope.
And there might be a better time. You might be in a better mental space one day and want to open the email and read it you know,
Yes.
another
Like
day.
if you're mid-cycle and you're feeling optimistic, that's a good time to read the email. If you got your period 2 hours ago, yeah, not such a good time.
Exactly. Absolutely. So I wanted to also talk about baby showers and other sort of baby centric events, or even not so baby centric. You know, I think just being around people sometimes can be tough when you're going through a tough time. Personally, I don't love like having to make small talk like when I'm going through a rough time. Like I actually come from a big Italian family, and I'm okay with being around my family because I know it's like a safe space, but put me in front of like a room of strangers and I'm like, I don't want to, you know, I just had a miscarriage. I don't want to talk to you about the weather. So I guess, you know, if you get a baby shower invitation and it's a close friend, like what do you do? Does it depend on your mindset at that moment? Do you protect yourself at all costs?
Yeah, you don't go.
Yeah.
I mean, honestly, I tell all my patients, there's no need for you to go to a baby shower.
Yeah.
And if it's somebody that you sort of like, it's a friend, but not like an intimate friend, you just say, I'm sorry, I have plans. I mean, tough now with Zoom baby showers, but if it's a real, you can just say, I'm really sorry, I have plans that weekend, and then send a lovely gift. If it's someone closer to you where you kind of can't get away with it, or if they sent a save the date, 8 months ago, then it's tougher. So I would just say the morning of the baby shower, tragically, you develop a terrible stomach bug.
Or you get
or
COVID.
you've just been exposed to someone. But actually, I would say a stomach bug, people are so phobic about stomach bugs that I just think developing a stomach bug, but again, send a lovely gift. And I don't want my patients having to go to baby stores or even look through baby gift registries, which are tough. I would just, this is what I tell all my patients, think about the books you loved as a kid, like your kids' books, like, Harold and the Purple Crayon and, Blueberries for Sal. And these are the books I loved. Go online to your favorite bookstore and order a bunch of kids' books and send those as your gift. Because if you go to baby showers, no one gives books. They give, baby clothes that the kid, burps on once and never uses again. But children's books, they're going to use over and over and over again. And it just isn't as painful to order books that you love as it is to look at little pink, cute things.
That's a really good tip. I like that one. So, I mean, what if they decide to go to the baby shower?
I'd say, go to the baby shower, but probably have to leave before the gifts get open, because I think gifts being open is really hard. And I would, one of the things I feel really strongly about is that people have what I call snappy comeback lines. And, Liz Grill, who's the psychologist at Cornell, she and I wrote this app called Ferticom. It's actually Ferticom Pro because we just updated it. And what we have there are all these scripts for how to handle stressful situations. And so we came up with like, I don't know, 50 different situations. And then we have scripts in terms of what you can say. Because, I don't know about you, I'm the kind of person that if someone says something mean to me, I think of a response 3 days later. I don't think on my feet. And so, in fact, I just led this workshop for the last week on a cruise ship to physicians. We were talking about snappy comeback lines. And I said, you need to think about the things people say to you that bother you the most and think of responses or memorize responses. So, and I have sort of 3 categories of responses. The first is polite. Just, when are you going to have kids? And you can say, well, when God decides, or, something pretty benign. And then the second one could be educate. And, when someone says, when are you going to have kids? The second one could be, well, it's not so easy for some of us. And, we'll let you know when we have good news, which is educating the person a little bit, but not being mean about it. And then the third one is called the zinger, which is, when are you guys going to have kids? It can be, well, we're going to see how the dog turns out. Or, something to sort of zing. I mean, the zingers are only reserved for people who ask you questions that you think have bad intent.
Yeah.
And there are people who ask, sibling rivalry never dies. People do ask, they're intrusive. When we were talking about this, one of the doctors said that what she does if someone asks her something uncomfortable, she'll say, how do you think that question's supposed to make me feel? Which I thought was a pretty cool answer. But if someone's really intrusive, yeah. Or what I like, someone else suggested, and why do you think that's any of your business? These would be zingers. I mean, you don't want to do that to,
Yeah.
your mother's sister because you don't want to destroy the family. And then, if it's someone you like, and if they ask you something in a loving way, then you want to use a polite or educating answer. But if you think there's malintent, you need to zing them right back.
Oh yeah, I love that advice. Someone actually last week, we were getting a home inspection on our new house, and the home inspector's wife asked me if my twins were natural. I was just like, no, I did IVF. and then I make them feel awkward because they, it kind of just makes them feel like, oh, I shouldn't have asked that.
You know what? That's sometimes why I like using the educate response.
Yeah.
To say, well, actually, no, we had a doctor helped us, but, it's kind of a personal question,
Mm-hmm.
And maybe that'll clue them in that they shouldn't say that to somebody else, because they shouldn't say it to someone else.
No, and a lot of it is, like you said, education. My mother-in-law always says that from following Fertility Rescripted on Instagram, she's learned so much about like what not to say to people. She was always the one that was like, when are you gonna have kids? Get to it and stuff like that. And so she's always like, wow, I'm learning so much through this platform because sometimes they just don't know not to say certain things.
But, I think it's a really important thing for people going through infertility to understand that if someone hasn't been through it, they may truly not know what is considered cruel or invasive or uncomfortable. And I had a patient once get super mad at one of her friends and came in and was like, all fertile people are, and she was like all upset. And this patient happened to be extremely wealthy. And I just loved hearing about her like weekend jaunts to Paris. Anyway, and so I said, tell me the circumstance. She said, well, I dropped in on my friend and she has 3 kids and she was so unfriendly to me. And I said, what did you say when you dropped in? And she said, well, my friend's husband just got laid off. And so, things are really tough for them. And I said, what did you say when you walked in the door? And she said, well, what we said was we were stopping by to say hi before we went out to dinner at some waterfront restaurant and then go to the movies. I'm like, okay. And so your friend who has no money and is stuck home with 3 little kids might have thought you were being really insensitive. And my patient's like, wow, I never thought about that. So I think we know what we're sensitive about, but if someone has not been through infertility, they truly may not know that things they say to you are considered. And I remember really close friends of ours got married before we did, and I wasn't in the field yet. And I was like just finishing grad school. And I remember like a year after they got married saying, so, when are you going to make me an aunt? Now, luckily they weren't trying at the time, but if they had been, I would have been a jerk.
Yeah. Yeah. No, I think that's a good segue too, to talk about some of the things people say that are well-meaning just because they don't know what else to say.
Right.
Like, you suffer a miscarriage and someone says, oh, well, at least you can get pregnant, or, at least it was early and you hadn't even heard a heartbeat yet, or, like just things that they think are placating you, but really it just kind of underlines the fact that they do not understand it at all. And you kind of feel a little bit more alone then, because this could be someone really close to you, your friends or family members. So that's why having a community, I think, is so important, because you need those people who actually get it. But do you have any advice for kind of responses? Would you use the same sort of 3 sets of responses for those people, or?
I would, it's actually funny. So, I'm in Seattle right now because I just got off teaching this course on a cruise ship, and we're flying back to Boston this afternoon. I'm actually in an infertility specialist's office so I could do this at Pacific Northwest Fertility. And Dr. Shaheen, whose office I'm in, she and I are doing a seminar at the reproductive medicine meetings on teaching physicians and nurses how to be more sensitive to patients who have pregnancy loss. And so, I'm sort of thinking in my slide deck, what was I saying? And, the issue is if someone's been trying to get pregnant, and especially if they had infertility treatment, the minute they hear they're pregnant, they're thinking names, they're planning the nursery, they're thinking colleges. I mean, you can be 5 minutes pregnant and you are pregnant and you're going to have a baby and you just fantasize, no matter sort of what your history. And so when people say, oh, it was early, or, you know, I hadn't even seen a heartbeat yet. Yeah, tough luck. That was still in the person's, a couple's mind. They lost a baby. And I think people need to say that. You know, I had a miscarriage in between my two kids, and I felt like I had to, you know, really educate people who said stuff to me like, well, it was God's will, or, you know, at least it was early, or at least it wasn't a full-term stillbirth. Like, wait a minute, it was still a baby that we lost. And
Yeah.
so I felt the need to educate people. But I think memorizing things to say to protect yourself when
Yeah.
you're that vulnerable is really important.
Yeah, I mean, so I recently had a chemical pregnancy, and my doctor, you know, she's wonderful and I really love her, but she called it a chemical pregnancy. But in my mind, I was like, well, I feel like I miscarried. Like, am
You
I
did.
not
You did.
able to like grieve that in the same way? And she in no way
Mhm.
said that, but like I felt like because it was a chemical pregnancy and not a miscarriage, that it was, you know. But for those 4 days in between my betas, well, in
Yep.
between a positive pregnancy test and my second beta, you know, I was
Mhm.
pregnant. And so
You were pregnant for 2.5 weeks, because clearly there was implantation. And I would, you know, there are so many horrible terms in our field, my field, in reproductive medicine. I think chemical pregnancy, you know, it sounds like you swallowed a bottle of bleach. I mean, it just is a horrible term. And so I'm trying to get everyone to say, as opposed to chemical pregnancy, saying an early pregnancy loss, because an early pregnancy loss defines what it really is and what the meaning was. And your first beta could have been 10 and
Mhm.
you were still pregnant.
Right.
And,
Yeah.
you know, I found this out the hard way. I had a patient whose first beta was 11. And I think 2 or 3 days later, it was like 20. And her physician said, this is not a viable pregnancy. Like, basically go home and have a glass of scotch. She ended up having a perfectly healthy baby. And so apparently about 10% of the time when you have these low betas, there actually can be a healthy baby.
Yeah.
So, you know, but no, I don't like chemical pregnancy. It is an early pregnancy loss.
Yeah, actually, a company called Peanut, they recently did this whole ad campaign about the different terms in fertility, pregnancy,
Mhm.
motherhood that need to go away.
Oh God, it's hostile. It's hostile cervical mucus. There's I'm talking about
Geriatric pregnancy is like
advanced
the word
maternal
they're
age. I mean, it's horrible. There's horrible terms. Yeah,
yeah,
yeah.
agreed on that.
Ovarian failure. I love that, ovarian failure. Like, what do you mean you're over? Anyway, don't get me started, because there are a lot of awful terms out there. Yeah,
Absolutely.
we need to sensitize the language, and I think chemical pregnancy should be one of the first to go.
Yeah.
So I'm sorry for your loss.
Oh, thank you.
That was a real loss.
Thank you. I appreciate that. So for those who might not be facing triggers right this second, but are just sort of overwhelmed on the journey, you know, it's stressful, it's time consuming, it's, you know, you're on hormones. What is your typical sort of, you know, are there any or any things that people can put into practice on their day-to-day, you know, journey that could help them with their mindset or anything like that?
Well, first of all, I'd be shocked if anyone going through infertility didn't have triggers, because I think there are 100 things a day that could bother people. I mean, going on social media, looking at People magazine to see which 54-year-old celebrity is pregnant with twins. I mean, there are triggers every day. You see pregnant women everywhere. You see babies everywhere. You know, if you're, you know, 25 to 45, your friends are having babies, your relatives are having, I mean, the whole world seems to be having
When
babies.
you're at that age, it's hard to
It's
avoid.
very hard. So, I mean, I think there are lots of things. I mean, obviously I'm a psychologist, and I'm a strong believer in acquiring skills to bring down your stress level. And so, you know, what I teach my patients, what we call cognitive behavioral skills and relaxation skills, which is why Liz Grill and I wrote the app, because, you know, I think there are only 500 or 600 reproductive mental health professionals in the country. And, I obviously would say if people are really struggling, they need to ask their infertility doctor for a referral for counseling, because there are people like me out there who know a lot about infertility and specialize in counseling individuals and couples going through infertility. But I'd say, that's why Liz and I wrote the app, because we'd have patients come in and say, oh my God, I really needed you Saturday night. It was 11 o'clock Saturday night and I got my period. And, my husband just isn't really sensitive at times like that. And I needed something. So that's why we basically, added all the cognitive behavioral suggestions we give to our patients and the relaxations we lead our patients through in the app. But, there's this community, Resolve has a lot of information. And I would, asrm.org lists all the licensed reproductive mental health professionals in the US.
Oh, wow. That's a really great resource, because I always kind of recommend that people find someone who, either specializes or knows what it's like in some way, because, otherwise you feel like you're explaining the science to your therapist. And I'm like, I'm already,
which you shouldn't have to do.
Right. I'm already doing that with my family members and friends. I don't want to explain to my therapist what an embryo transfer is.
Well, it's funny because twice a year I do a training where I train mental health professionals from around the world on how to counsel infertility patients. And the first half day is called, medical aspects, what every mental health professional needs to know about the medical aspects. And everyone's like, well, why do I need to know this? And I said, because even a patient walking in and said, I just had an IUI and I'm feeling really crampy. And you ask her what an IUI is, you're going to lose her. Yeah. Because every infertility patient in the world, this is a global thing, not US, is forced to educate themselves to this insane degree, because you have to get through all this. You have to learn a lot about infertility. Yeah. And if you go see a therapist who doesn't know anything about it, first of all, she's going to think you're crazy. All the things that I consider to be totally normal, someone who knows nothing about infertility will think you're crazy or that you're too depressed or whatever else. And that you need someone who gets it, who knows the terms, who knows the normal reactions to the different stages, who understands what each treatment means. And so, it's the truth for anything. I think you have to see somebody who's going to really get you, and which means they have to be experienced with infertility patients. A lot of therapists in this country who are in reproductive medicine went through infertility themselves. And so they can be really empathic, which, and they'll really get it.
Yeah, that makes sense. So that's kind of all of my, major questions, but I wanted to ask you as sort of a last to end on. Our name is Rescripted. We're rescripting the fertility journey. So we always like to ask, what would you sort of rescript? In other words, what do you wish, people knew about struggling with infertility, or either patients or people who are kind of looking in?
Well, I'd say for patients, I'd say what's normal in my world is that this is really hard. I published a paper like 25 years ago that showed that women with infertility had the same level of anxiety and depression as did women with cancer, AIDS, or heart disease, which was like, whoa. We get a ton of media attention, and everyone's like, that's impossible. It's just infertility. I'm like, no, it's not just infertility. Procreation is the strongest instinct in the animal kingdom. And so it's not just infertility. And then we published a paper at Boston IVF, about 6 months ago, where we actually surveyed over 3,000 Boston IVF patients as COVID hit. So it was the spring of 2020, and basically asked, what's the biggest stressor for you? And most of the infertility patients said it was infertility. It wasn't COVID. And that was, Boston got hit very hard because of the Biogen conference. And so there were huge rates of infection. And yet our patients still felt infertility was harder for them, which was no surprise to me. I think a big surprise to some of the physicians who were working on the study. But I kind of predicted it, that I think when you're going through infertility, it's hard. It's hard. And so you need, it's
all consuming.
It's all consuming. As I said earlier, it affects every aspect of your life. And so you need to do something to help yourself feel better, whether it's finding a therapist, using the Fertility app, spending time reading stories from other people on Rescripted. But I think it's unusual for someone to be able to do this entirely alone. I think that you really need some support somewhere. This is hard.
Yeah, no, I mean, it really is. And when I was going through it the first time around, I was under 30. None of my friends were
Yeah.
even trying to conceive, let alone going through IVF.
Mm-hmm.
So, who do you turn to? I mean, I would tell my mom or my therapist, but I was explaining the science to them more than anything, like I just said. And so, if not for a community or at least one confidant or a counselor, like you said,
Right.
it's really tough too. I always admire, we get some women in our support groups that say they haven't told a single soul about their journey, and I'm always shocked by that, because I mean, I'm obviously an open book, but and I know not everyone is, but I'm always shocked that they haven't just told like maybe one or two friends, or
No.
But
Well, we actually published a study a couple of years ago that was a global study, and 57% of the women hadn't even told their mothers.
wow.
And that's often because if they're married to a man, a lot of men, especially if it's male factor, don't want anyone to know. But there's also just sort of universally people, and they shouldn't, but people tend to feel a lot of shame, a lot of embarrassment, a lot of guilt, and they don't feel comfortable sharing. And so they just pull away from people and they get really lonely. And it's really hard to go through a crisis when you're not able to share it with anybody else.
Yeah. I mean, my thought process when I did start sharing was that maybe I could avoid potential triggers if I, told my mom and my mother-in-law, so that they weren't kind of badgering us about when they were going to get grandchildren. And so that was my, I guess, coping mechanism. But I can also see how, because when my cycle started not working and my first IVF transfer failed, I did sort of get to a place where I was like, I'm done sharing. Like, and I think it's important to note that it can change, like one day you might want to share and another day you are like, or another cycle, you're like, I don't even want anyone to know I'm going through this time around. And I'm not even, if it works, great, I'll tell everyone at 12 weeks, but if not,
Yeah.
I can't tell anyone bad news anymore. I remember getting to that point, and it was a really sad point.
But you see it often with miscarriage. I remember my sister had a miscarriage, and she told everybody she had a miscarriage, and she said people came out of the woodwork. And the same thing happened to me when I had my miscarriage. One of my best friends told me she had a second trimester loss, which I had not known. It was before I met her, but it was, and it was like, I felt like everyone I knew had a miscarriage and then never talked about it. So I think sometimes, in our society, miscarriage is sort of taboo. You don't even tell people until you're 12 weeks, so they don't have to share your grief if you lose a pregnancy. But as I said, it's a death. And I think it's the time when you need the most support.
Yeah. And to that point, I do love when, people with large platforms like celebrities and stuff come out and say that they've had a miscarriage or have gone through IVF, because, it kind of gives those people who are kind of suffering in silence permission to, or it validates their feelings and gives them permission to sort of grieve in the way that they need to.
I totally agree. I mean, I have to say there are a lot of, I'm not one of these like big celebrity kind of people, but whenever a celebrity, talks about their infertility, I'm blanking, the weather person, Dylan on the Today Show. But she was so open about her infertility and, having to go to an infertility clinic, and, any celebrity who talks about infertility and going through treatment and having IVF or using donor egg or having a miscarriage, like, God bless them, because, that's very brave. And I very much appreciate it, because then my patients feel, well, if so-and-so can talk about it, maybe I can open up a little bit.
And Dylan, I'm an avid Today Show watcher as well. And Dylan's was interesting because secondary infertility is, and I know, I think secondary infertility can be, I don't want to compare it to primary infertility at all, but I think a lot of people suffer in silence because they are like, I should be grateful. I mean, I feel that way. Like I hit the jackpot with IVF. Like I have my twins and they're healthy and I couldn't ask for more, but I want to grow my family. And so I feel that like sense of push and pull guilt.
Mhm.
And I think a lot of women with secondary infertility feel that way. Like, I should just be grateful for what I have. And they also are less likely to seek treatment, I believe. Is that true?
They're
Because
less likely to seek treatment, but the research actually shows that women with secondary infertility are just as distressed
yeah,
as women with primary. And women with primary are like, how can that possibly be? You have a healthy child. And I'm like, well, first of all, they know they can get pregnant, and it's frustrating not to be able to get pregnant again. They get very concerned about the age spread because, people have in their head, they really want their kids to be 2 years apart or 3 years apart. And I have patients now who, their kids are going to be 5, 6, 7 years apart. And when you're going through primary infertility, to some extent, you can avoid the child world. You can escape from the child world. If you have a child, you have to, go to preschool and see all the other pregnant moms, and you have to go into toy stores, and you can't insulate yourself nearly as much. And you might have a little person saying, I want a baby brother or sister. And how do you explain that? So I understand that primary patients don't get secondary, and I think that's completely valid. But I also know from the research that secondary patients do have the same level of pain. It may be for different reasons.
that's a really great point. I was away earlier this week, and I kept, probably just because my brain was doing this to itself, but I just kept seeing people with like 4 or 5 kids. And I was like, wait,
Yeah.
1, 2, 3, 4,
Yeah.
5. And I was like, why
They're
am I
all
doing
IVF.
this?
It's okay. They're all IVF. Yeah.
They're all IVF. Yeah, no, I was just like, I was actually kind of laughing to myself because I was like, I think my brain is playing tricks on me. It's like noticing all these people with large families. um, well, thank you so much, Dr. Domar. This was so helpful. I think this is going to help a lot of people, manage their triggers and seek help if they feel they need it. So I appreciate it.
My pleasure. Thanks for inviting me.
Of course. And everyone go download the Ferticom app.
Thank you.
All right. Well, have a great
Okay.
rest of your day and safe trip
Great.
home.
Thanks so much. Thanks, Kristyn. Bye.